16 weeks post-op. That's right, I'm 4 months post-op from my all-on-5 dental implant procedure. Hello, my name is Jane. Thank you so much for joining me on my YouTube channel. Today I am 16 weeks post-op. Today is February 8th, 2022. I had surgery on October 19th, 2021. That surgery was done by my surgeon, Dr. Christian Yaste. He is at the Ballantyne Center for Dentistry that is in Ballantyne, North Carolina, and a suburb of Charlotte. So the specifics, let me get into them real briefly. If this is your first time here, then you'll want to know this. If it's not, then just bear with me. On that day, October 19th, Dr. Yaste did 24 extractions, a sinus lift, bone grafting, and 10 implants were placed, 5 on the upper, 5 on the lower. I had a 7.5 hour under general anesthesia, and that was a pretty long time, let's face it. That would be a long time for anybody. And when I woke up from that procedure, I had my lower temporary arch placed. However, on the upper, I did wake up and go home with a denture. That denture was there for, I think, 13 or 14 weeks. On January 20th, I went back in to Dr. Christian Yaste. He did another surgical procedure, and he opened up my upper arch to check on the stability and the location of the implants that he placed that day. The good news is that those implants took, so they were able to put my temporary arch on that day. I came home with a lot of stitches in my mouth again and some more recovery, but yesterday I went back again for my checkup, and everything is looking great. Still have the stitches, which is common for me, for those to last a long time, but things are healing well. My gums on the upper are healing well from that procedure that was done on January 20th, and so I'm really super excited. So let's talk about what they did yesterday. Yesterday, for the first time, they were able to remove the lower arch, and they removed the upper arch again. So both of them were removed yesterday, and they were able to check for the first time and test the lower implants to make sure that they have taken and that they were stable, and they did the measurements yesterday. And I am happy to report, not only on the bottom, but on the upper, all of them, all 10 have taken. My doctor said full integration. So that, I could not ask for a better result. I'm so excited. Full integration. His words, hard as a rock. Everything is perfect. So that was the best news that I could have received. So I'm super happy about that. But I wanted to come on anyway today and just share that news with you all. Let you know how excited I am, how happy I am with the look of my temporaries right now. And as always, I give you a big smile. My doctor did take a lot of photos yesterday of every step of the procedure, and I just couldn't be happier. So where do we go from here? Well, I have another appointment 1 month from today, and that will just be another step closer to pinning down those permanent teeth. Those will be the zirconia is my chosen. So those permanent zirconias will probably come in the next 3 or 4 months. But I do have probably 2 or 3 appointments to get to that place. We're not ready to choose, the size, style, color of the teeth yet, but that'll all be coming soon. So that's an exciting process. He did say, my doctor said he already knows what color I want, just based on what every woman wants. And I said, if it's really white, then yes, that's what I want. So anyways, I'm so pleased. Just a couple of things that came up that I wanted to just share with you, just in case you're going through the process right now, you have some questions. Maybe you've just started the process and you have some questions about how you're healing. So I just want to let you know that it's okay if it takes you longer than what they say. I always take longer. It's absolutely okay. It's not abnormal in any way. Your body does what your body does. And, you want the best results. So however long it takes to heal, just let it go. I still am on more of a soft food diet. Anything that I could cut with a plastic fork, I can eat. If I can't cut it with a plastic fork, I still can't eat it. Still cannot. Don't want to do anything to screw these babies up. This was $45,000 that I invested. So I'm absolutely going to do what I'm supposed to do. One question that I had, and actually I did the research on my own, but I noticed previously when I was healing from my first surgery, and then again on this surgery, the tissue, the white tissue that you get in the location of maybe where the teeth were pulled or where your implants were placed and you have stitches. At first I thought, when I had the first surgery and I went back in and had my checkups, I thought, am I not cleaning properly? Am I not cleaning well enough? Because I saw that in there and I was like, I think I'm missing, or I don't know what I'm doing wrong. The dental tech that day said, don't pick at that stuff. Don't get rid of it. It's there for a reason. It's supposed to be there. So I did some research on my own, and that is called granulation tissue. Granulation tissue is going to arrive at that surgical point usually about a week after you have anything done. Even if you just had one tooth pulled, you may still get that. The first stage is when you get the blood clots in there, and it starts to heal, and then about a week later you'll see this white tissue starting to form, and that's what it's supposed to do. What that is doing is really, it is providing a damper or providing a protection against those surgical sites so that they can heal and things don't disturb them. So you want to make sure that you keep that in place as much as possible. Now yesterday, because they were doing some work in there, they did go ahead and remove that. So when I came home last night, I noticed that it was all gone. So I assume that will come back again. Maybe not. Maybe I'm far enough along now that it won't, but fully expect that it might. So don't do anything to disturb that stuff. Also, at this point, because I'm fresh on my uppers, just waiting for those stitches to come out. So I'm going to be very careful. I'm still not going to be using the water pickup of there, so I'm going to be super careful on how I'm taking care of those teeth or those gums, because I want to get good healing done. What else do I have to tell you today? I'm trying to think, and I'm kind of drawing a blank. I'm so excited just to share the good news. One other thing while I'm thinking about it. Let me tell you how shocked I was. Maybe I was surprised as well, but I didn't really realize. I guess I probably thought about it. I did think about it, but I was shocked at the degree. Let's say that. I was shocked at how smelly it was when they took my arches out. And I have to assume that there's a lot of debris and, food stuck in there that I possibly couldn't get out right away. That's the only thing I could think that's what that smell was, because it was disgusting. And I had the big, mouth opener in, so I couldn't really talk, and they were taking photos and stuff, so I didn't want to interrupt that process. But what I really wanted to say was, oh my God, that is so gross, and I am so sorry. I am so sorry that you had to smell that. I was just really shocked and taken aback by that. So I think that's probably a normal part of it. If you've had this process done and you've experienced that, please drop a comment down there and let me know and tell me your experience and if it was quite as bad or as shocking to you, or if you knew about it. Nobody said anything. My surgeon and his assistant, neither one of them said a word about it. So I think that they were just being nice and didn't want to embarrass me. Okay, so I've got to get back to work. I just stopped today. I'm working from home. Obviously, I am looking pretty bummy, not looking my best today, and you can hear the emails and instant messages coming in on my laptop, but I just wanted to stop, make a quick video, share the good news with you all. Thank you so much for your engagement on my channel. I've got lots and lots of views, but not so many subscribers. So I see that over 2/3 of you who are watching my videos are not actually subscribed. So if you want to help me out and just go ahead and subscribe to my channel, you'll get a notification on your inbox for YouTube when I post a video. And I appreciate all the comments and likes and views. And until next time, everybody take care. Bye.